Understanding the Neuroscience of Addiction, a comprehensive guide. The human brain is an intricate machine responsible for our thoughts, actions, and feelings. When disrupted, it can lead to complex conditions like addiction. Addiction isn't a moral failing or lack of willpower. It's a neurological disorder, a result of changes in the brain's structure and functions. Our brain is divided into different regions, each with specific roles. Some areas are critical in the development of addiction. The reward system motivates us to repeat behaviors that ensure our survival. It's deeply affected by addictive substances, which hijack this system. Addictive substances provide an intense, artificial sense of pleasure. The brain then craves to recreate the same pleasure, culminating in addiction. Over time, the brain adjusts to the excess dopamine caused by these substances. This makes other joys seem less pleasurable, driving people further into addiction. The amygdala controls our stress response. When addicted, this region signals distress if the substance is not consumed, causing withdrawal symptoms. Frontal regions of the brain help us make decisions. Addiction impairs these areas, reducing the ability to resist urges. Addiction is not a choice. It's a disease that affects the brain and requires professional help. Understanding this is the first step to overcoming it. If you're struggling with addiction, remember, you're not alone. There are various resources and treatments available to assist you. Recognize the signs. If you can't stop using the drug, fail to fulfill obligations, or are constantly thinking about the drug, you might be dealing with addiction. Denial often accompanies addiction. Acknowledging the problem is a major step towards recovery. Seek professional help. A healthcare professional can diagnose your condition and guide you towards the appropriate treatment. Detoxification is often the first step. It involves clearing the substance from your body, usually under medical supervision due to withdrawal symptoms. Rehabilitation centers provide structured treatment programs. They focus on helping you understand your addiction and developing coping strategies. Medication can help manage withdrawal symptoms, lessen cravings, and treat co-occurring conditions. Therapy, especially cognitive behavioral therapy, helps you identify triggers, develop coping strategies, and replace negative thoughts and behaviors with healthier ones. Support groups provide a community of individuals who are experiencing the same journey. They provide comfort, reduce feelings of isolation, and share practical insights. Fitness, a healthy diet, and adequate sleep can aid recovery by improving mood and reducing stress. Recognize that recovery is a lifelong process. There will be setbacks, but perseverance is key. Helping someone with an addiction can seem overwhelming, but your understanding, patience, and support can make a significant difference. If you suspect a loved one is struggling, have an open, non-judgmental conversation with them. Express your concerns without blaming or shaming. Encourage them to seek professional help. Offer to accompany them if they're comfortable. Educate yourself about their substance of choice and its effects. This understanding will help you better empathize and provide support. Avoid enabling behaviors such as covering up for their addiction or providing them with money. Set boundaries to protect your well-being. Supporting someone with addiction can be emotionally draining, and self-care is crucial. Encourage healthy habits. Exercising together, preparing nutritious meals, or practicing mindfulness can help your loved one heal. Recovery is not linear, and relapses can occur. During these times, encourage your loved one to seek help immediately and reassure them that setbacks are part of the process. During their journey, celebrate their small victories. This boosts their morale and motivates them to keep going. Find a support group for yourself. Connecting with others who are in the same situation can provide emotional relief and practical advice. Lastly, remember that you cannot fix your loved one. They have to want to recover. Be patient and keep offering your support. In conclusion, addiction is a neurological condition, not a choice. It requires treatment and ongoing commitment to recovery. If you or someone you know is struggling, reach out for help. It's never too late to start the journey to recovery. In understanding the neuroscience of addiction, we can combat the stigmas attached to it and foster a more compassionate society. Let's end the silence around addiction. Speak up, reach out, and let's create a world where no one has to fight this battle alone.